Good afternoon. Today I'll continue to be talking about the coronavirus. So today I want to talk about another potential drug treatment that was found by researchers in Melbourne, Australia, which is quite interesting. So this potential treatment is a drug called ivermectin, and it was first discovered in the 1970s and was used widely in the 1980s as an anti-parasitic drug used to treat head lice and scabies and other infections. So the interesting thing here is that it is commonly known as a really safe product. It is approved by the FDA and the MHRA, and it can be used in the form of lotion, shampoo, and pill. So, another thing about this drug was first discovered by researchers of this drug in Monash University, and so when the virus came out, they immediately tried using this drug, and during this laboratory setting, what they found was that first they injected healthy cells with the novel coronavirus, and after 2 hours they injected a single dose of ivermectin, the drug. What happened was that, quite interestingly, after about 28 hours, the drug have already to show that parasitic was the viral RNA in the drug was significantly reduced, and the entire virus was wiped out 99.8% by 48 hours. And on the third day, the coronavirus was eliminated entirely. So the exact cause of why ivermectin works against the virus is unknown, but researchers believe that the drug paralyzes the virus and overwhelms its nervous system, which then impedes its replication process. And when the virus cannot replicate, then it basically means that the virus is going to die off. So here I just wanted to make a mention that here is simply really interesting to see how researchers can think of such a drug to treat the coronavirus, which is so there's absolutely no correlation between the two. I mean, who would have thought that a drug used to treat head lice was going to be a treatment for the coronavirus, which is a respiratory disease and basically have nothing to do with head lice and scabies. And I just want to say that at a time of crisis, I mean, the scientists and researchers really work together, and the creativity just booms at a time like this, and it's just trying randomly new things that seem to have absolutely no correlation, but can actually have a result of working, and that's just really admirable. I think here is that these scientists can think of a drug used to treat head lice for the virus, and I hope that this kind of new drugs, vaccines are developed every day, even though they may seem to have no correlation, and which is really going to help the population. So the next steps of this virus is going to be going into clinical trials, and because currently it has only killed the virus in laboratory settings, we'll see if the virus continues to kill in humans after the clinical trial, and so now we'll just see what's going to happen next. And so the second thing I want to talk about today is that for the first time in New York, yesterday and today, the number of deaths and cases are dropping from the day before. So here now, the governor of New York and many health officials say is the curve finally flattened. So have we finally reached the apex or the height of this outbreak and now we're continuing on to decline, or was it simply just a blip and it will continue to rise tomorrow or today? So that exactly is unknown, but I feel like over the next few weeks, this week actually, next week is really critical to how the virus is going to spread in the U.S. But I think that with the cases already delayed for a time as long as this, that I think we're going to finally have something to maybe perhaps reaching the apex this week, next week I mean, and maybe we'll start declining, I guess, weeks after. But I mean, the virus is going to return. We know that for sure. The virus is probably going to return next year or the year after that, but we just make sure that we have a vaccine to protect ourselves against. That's it. Thank you for listening, and I hope you have a good day.